Same thing happened with Fannie Mae and Freddie. Hold on a second, if I could, Dr. Siegel. And we've got someone from the bar here to ask a question.
Jeff, this is Jeff Banks, CEO of a la carte. Actually, this is the a la carte parent company of Carmine's, Virgil's. I should be your PR.
I was going to say that was well done.
Thank you.
Go ahead.
My question is about small businesses and how we can help the country out. If I open up another Carmine's, I could create 200 skilled and unskilled new jobs with health insurance, but I need help. There's no credit. It's been a year now since this crisis. The banks have not started to flow back. How can we get help? I see the cash for clunkers. I see the $3 billion. That's maybe a handout. How can we get help? Maybe we need like a cash for cannolis program or something.
Congressman Hoekstra.
No, actually what we need to do is we need to go back and we need to reduce taxes. I mean, the government took the first bite out of the apple and they ate the whole apple when they did the stimulus bill. $787 billion of government spending. We've only spent 9% of it in 6 months. Just think of what would have happened if we would have had a cash, for your restaurant, a cash for cannolis, for all of these folks, and we had put the money back into consumers rather than into government programs. We would have had a lot more impact a lot quicker than what we've seen today.
Representative Kucinich, I'd love you to jump in on this. We talked about this on Saturdays because he's been a wonderful guest on our Saturday show. What are we doing for the small businesses out there?
Well, I'm glad the person asked that question because small businesses can't get credit even though Congress supposedly anteed up $700 billion in funds that were supposed to be channeled into liquidity for businesses across this country. I'm hearing from businesses in my own district. They're going belly up because they don't have access to credit. We ought to have a separate show about small businesses' lack of access to credit. The banks are parking their money at the Fed, and they're getting more money on the interest, and the small businesses are going broke. This is a problem with liquidity in the economy that's deliberately being manipulated by the Fed and by the Treasury, and small businesses are getting it in the neck. Now, in health care, under my plan, H.R. 676, small businesses would benefit mightily. Under 3,200, they'd even benefit. And Pete, you're a friend of mine, but I have to tell you, the reason why you've had 400 to 500 hospitals close in the last decade across this country is because of the private for-profit health insurance system, not because of a single-payer system that doesn't exist yet.
Representative Kucinich, just 1 second. I also want to introduce our next guest. We have, I guess I'm going to call you a panelist, actually, today, if that's all right.
You're one of us today.
Dr. Erica Schwartz, Synergy Health Chief Medical Officer. We're going to get one more question here, and it'll probably, hopefully, be somewhat healthcare related. We'll start off with you on that.
I'll be here.
Go ahead.
My question is for small businesses that are providing health care, privately. If they don't go on the public option, why would they be audited? That's what the bill says. They will be audited if they don't use the public option and they want to pay up and get private care.
By the way, introduce yourself real quick.
Steve from Chicago.
Steve from Chicago. All right, thanks. You want to go ahead and tackle that, or you want one of the congressmen to start off there?
Go
ahead.
Warm up first. What's going to be audited is the government's going to make sure that you're doing exactly what we have told you to do, that you have to provide health care and that you've got a plan that is appropriate and meets government guidelines. Remember, the only thing that you're going to be able to buy is you're going to have to go to this insurance or this exchange where the only plans offered on that exchange are plans that are approved by the insurance commissioner, this new government commissioner, this new czar, and you may not be able to offer the same plan that you have today. You will have to go to that exchange to figure out what you can and cannot provide to your employees.
Dr. Siegel, you are a doctor, but you are a small business as well. What do you think of all this?
I was actually about to say that, Trace. I'm actually concerned as a small business that I could face a situation where my employees are having a health insurance that's costing me a lot. My expenses are going up. My reimbursement is going down. And so I might decide to take a penalty and actually allow, if there is a public option, my employees to have that public option. That's why a lot of people out there are afraid that if there is a public option, more and more employees will end up in that public option. That's not spin. It's not fear-mongering. That's a reality that could happen because the employers may decide to take that penalty.
Dr. Schwartz, on that note, I think one of the fact is, though, the trends are there. Whether it's 14 million or 49 million, more Americans have less health insurance today than they did 10 years ago. Costs are much higher today than they were 10 years ago. Right. What do we do to stop the juggernaut, if not something with the Republicans in Congress and the lobbyists who are writing the bills for them?
Well, we absolutely need to do something about it, and what we need to do is bring them together. I mean, I think there are a lot of good ideas about combining the public option with the private option, bringing them together. And I think that that's where you're going, maybe the government should come in and provide legislature to help us figure out how to find the balance. And I think that there's a lot of problem with anything that's extreme. Anything that goes one way or another is going to get us into further trouble.
Representative Kucinich, let's let you get the last word on this.
Well, right now, small businesses are one of the most discriminated against in the present for-profit insurance system. 27 of the 47 million Americans who are uninsured are connected with small business. We see small business will spend $2.4 trillion more over the next 10 years if we don't have reform. And finally, they're paying about 18% more than bigger firms. This is why we have to have a change. Now, 3,200 may or may not be the solution, but a single payer is.
All right, guys
Thank
and
you all.
gals, we have to pause for a moment. But stick around. The healthcare issue has a lot of people asking a lot of very important questions, as you see right here, guys, and that's exactly what we're here for. Our panel stands ready to answer your concerns, all your questions, when this very special happy hour town hall continues live from the Bull and Bear in New York's Waldorf Astoria Hotel. Where else would you have a town hall but the Bull and Bear Bar?
It is.